Hi, and welcome to Attentive Healthcare Solutions webinar, Locking Down Your NextGen System from the Inside Out. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. Before we dive into today's webinar, I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention this webinar will be recorded. We'll send out a copy of the slides and recording within the next week. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen Healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have NextGen add-on productivity solutions, including ChartGuard and Refund Manager. Speaking of, I wanted to mention some upcoming webinars that we'll be presenting. On Tuesday, we'll be doing a demo of ChartGuard. ChartGuard is a NextGen productivity add-on that we created to help protect your practice during a system outage. It automatically creates PDF copies of your patient charts so they can be accessible anywhere, anytime. And on July 15th, we'll be doing an educational webinar on regulatory changes to be aware of for 2021 and beyond. In that, we'll be exploring advanced use criteria, E&M coding changes for 2021, interoperability updates, and what all that means for your NextGen practice. Keep your eyes out for those webinar invites. We hope to see you there. Okay, so back to today's webinar on locking down your NextGen system from the inside out. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Lexi DeMarche is Manager of Consultant Development at Attentive. So Lindsay, the webinar is all yours. Take it away when you're ready.
Great. Well, thank you, Chelsea, and thank you everyone for joining us today for our webinar on locking down your NextGen system from the inside out. So today we're going to focus on ways to lock down your practice data by patient, encounter, templates, and even document types in NextGen. We'll also demonstrate how to lock down your system and restrict access without creating separate practices within your NextGen environment. Our goal really is to make sure you're aware of external threats and then how to take action to lock down your system internally, focusing on NextGen specific ways to limit access to help keep your practice, patients, and even your remote employees right now safe from data breaches. You know, we are well aware that weak access controls can leave your data and system susceptible to that unauthorized access, from both external and internal threats. However, hackers, viruses, worms, ransomware, spyware, all the other fancy names out there for a malicious actor are not the only concern. Your own employees can accidentally or, unwittingly sabotage your systems or create a breach by accessing data that should have been locked down in the first place. So while our industry focuses on the image of that unknown hacker kind of lurking in the shadows of cyberspace, the reality is that threats from inside your network are by far the greater problem in data security. So we want to explore why we gave our webinar the title that we did, Locking Down Your System from the Inside Out. Always intentional with our titles here. There are actually two approaches to security and compliance, either an outside in or an inside out approach. So that outside in approach focuses first on identifying specific external cyber threats and compliance requirements, and then it reacts. We're going to be completely upfront. This approach oftentimes fails, and it's the reason why it's not the title of our presentation today. It can result in massively complex and costly security infrastructures consisting, of endless solutions that are impossible to manage and measure and maintain. It really does create kind of an operations environment in which there's never enough resources to manage all of these tools and services you have in place that were implemented as a response to an external threat. And these infrastructure and operational problems will actually escalate your organization's risk and create security vulnerabilities and compliance gaps caused, by either human error or even technology misuse. So while more and more new regulations emerge, it becomes harder to react and adapt with this type of approach. Because of this, organizations need to move from an outside in to an inside out approach to that security and compliance, where technology and processes are organized and optimized around organization-specific risk rather than that latest external threat that's out there. So unlike that outside-in model where that threat landscape dictates your security spend, strategy, and operations, the inside-out approach focuses first on the core requirement of reducing your own practice's risk. So in this approach, you're evaluating your risk and proactively taking steps to mitigate these risks. This means that your specific practice risks, not the threat landscape, drive your security strategy. So let's do just that. Let's start inside your practice. We already mentioned the healthcare industry so often sensationalizes the idea of that malicious hacker, that our biggest threat is truly often swept under the rug, which is the internal threat of your own staff and the threat that they can create. So we understand, and we hope you all do as well, the importance of education to your staff on this topic, which should really go beyond the required yearly HIPAA training. But it can be more than just education and awareness. So today we wanted to focus on actual actions you could take within NextGen to help lock down data and make it more secure for whatever reason you needed it to. So I'll actually hand it off to Lexi, and she will take you through all these cool features, I guess I'll call, NextGen's kind of built-in home security system and what it has to offer. So Lexi, it is all yours.
All right, thank you, Lindsay. Thank you everyone for joining us today. So we're gonna kind of examine some of the steps, as Lindsay mentioned, that your practice can take. That's just gonna help to ensure that the right people are able to see the right information in your system. So as we're all well aware, the NextGen software contains large amounts of confidential patient data, and not every user in the system needs to access all of that data in order to do their jobs. So let's take a look at a few ways that you can limit that data exposure. So before we actually jump into that content for today's webinar, I did just want to point out that there is a difference between having your system set up with separate practices within an enterprise and having one practice with separate locations. So really, when we talk about locking down data, setting up multiple practices within an enterprise is really the surefire way to separate those patients and all of their data, so you can really control what individual users can see. Each practice within that enterprise is going to have their own clinical and financial data, with the little caveat: if you use enterprise chart, that might not be the case. So if the desire is to completely separate your patient data among users, you want everything kind of siloed, multiple practices would probably be the best option. But we understand, there are some cost and logistical considerations, and that might not just be feasible for your organization. So with that in mind, the solutions that we're going to go over today, they're more geared towards how you can take that one single practice from your enterprise, and that might potentially have multiple locations. It's going to give you some measures that you can put into place, and that's going to help limit that visibility for users to only what is really required of them to do their job. So one of the most obvious methods that we'll go over today, that I'm sure you use in some form at your practice, is our security rights. But we're also going to go over some additional options with security rights that you might not be familiar with. So such as the ability to set up location, template, and document restrictions. You also have the ability to employ sensitive encounters. That's going to help limit how that confidential data is exported out of your system. And then we also have several options that will help you regulate access to patients as a whole. So things like our inclusion and exclusion lists, and also our privacy levels. So let's take a look at each of these solutions and see how they could potentially benefit your practice and its security. So as I mentioned, the first option that we're going to explore is probably the most obvious solution, something that I'm sure all practices use to some varying degrees. But I did want to briefly review the security rights, so how we set those up, and then share some additional functionality that you might not be aware existed. So our security rights for our NextGen system are configured in System Administrator. These rights are set up at the group level. So that means that the rights we set up are going to apply to all users within that group. A user can be a member of more than one group, however, So in that case, they would have the highest level of rights from all of those combined groups. So our security rights are divided into our two main categories. So we have our modules and operations. So those module rights, they are grouped by what they call programs. It's basically a program is just something that performs a particular task in NextGen. So for example, we might see module rights for things like the background business processor or access to file maintenance, things like that. For each of the individual module rights, we can assign or remove the right to view, add, update, delete, or print for that particular task. In addition to those module rights, our other group is operations. So these operation rights give users access to specific actions or maybe a task that's carried out in a module. So for example, we can assign rights to things like print claims or the ability to e-prescribe a medication. So our operation rights, these are a little more straightforward. So our options are just yes or no. So do they have access or do they not to perform that task? So through a combination of these module and operation rights, this is how really your practice can ensure that users only have access to perform the functions that they need to for their role. So as I mentioned on the previous slide, our security rights are set up by group. So one thing I want to point out though, this doesn't mean, however, that if you're setting up, let's say a new group or maybe an entire new practice, that you don't have to start from scratch each time configuring these rights. In System Administrator, on our Rights tab, we do have the option to both import and export our permissions. So to import permissions, I would select the group from the list that I want to import permissions to. On my Rights tab here, I would click on the Import Permissions button. And then from my pop-up, I would select the group that I want to import permissions from. So it's really that simple. And it's important just to keep in mind that when you are importing permissions, it is an all or nothing thing. So, if there are any existing security rights for that group, they are going to be overwritten. So our process to export permissions to another group, it's very similar to what we saw with importing. So again, in System Administrator, we would select our group that permissions would be exported from. And then we would click on that Export Permissions button, and we can select one or more groups to export those permissions to. So we have the ability to kind of set them up once for a group, and then we can quickly export them. So again, I just want to mention that with, like we saw with our importing permissions, when we export, it is going to overwrite any existing permissions for those groups that we selected. So as you can see, importing and exporting those security rights can really save you some time. So if you're adding a new group or new practice, we don't have to reinvent the wheel each time. So once your practice has configured those security rights for your groups, you may need to review those from time to time. So, maybe it's a result of a new policy that was put in place, or, just kind of reevaluating your system security. So there's a few ways that we can do that. One of the ways that you can review those rights is at the user level. So in System Administrator, when I click on a user from the left-hand side and go to that Practice Rights tab, I can actually see a list of all of those security rights for this particular user. So just keep in mind that this view is view only. So on this tab, I'm not able to make any changes because if you remember, those changes have to happen at the group level. This is just showing you what's existing for the user. So this feature can be particularly helpful if, let's say, a user is a member of multiple groups. So if you remember, I mentioned, they could have a combination of rights. If you want to review what access that particular user has, this view is going to show you those cumulative rights if they're a member of multiple groups. So in addition to viewing those security rights at the user level, which we just looked at, you may need to perform an audit of rights for a large group of users, maybe all the users in your system. So as you can imagine, clicking through each user in System Admin and going to that Practice Rights tab, that would be very time consuming. So instead, we actually have the option to run some reports in file maintenance, and that will let us see what security rights we have set up. So there are actually 2 reports that you can run in file maintenance in regards to our rights. So just kind of depends on what kind of data you're looking for. So the first is called our groups list report. So that's going to show you the security right settings that have been enabled for each individual group. So this isn't going to show us users in that group. This is just saying, for your nurses group or provider group, these are the rights you have turned on. And then our second report, our users list, that's actually going to show us what groups individual users are in. So as you can kind of imagine, depending on what you're looking for, you might use these kind of hand in hand, to first see the groups that the users are in and then see the rights, or, just maybe the groups list to evaluate, kind of how you have your rights set up in your system. So in addition to the use of those security rights, which I'm sure a lot of your practice is already using, your practice may also want to limit a user's ability to perform certain actions when they're not in the location that they typically work in. So restricting location access, it's not going to completely lock them out, so like a separate practice would, but it can help prevent users from either using another location for an encounter or for billing purposes. They might select it in error, so we can limit that by happening with our location restrictions. So our locations can be restricted for individual users in System Administrator. So when we have a user selected, there's actually 2 different tabs that we can use, just depending on how much you would like to lock down with your locations. So our first tab, our Locations tab, that's going to allow you to select the preferred locations for a user. So these are going to be the locations that the user is going to have full access to. So typically, either the location that they work in, or if they're a scheduler, maybe the locations they need to schedule for, things like that. So in addition to selecting those preferred locations, we also have several checkboxes on this tab. And that's going to, in addition to just making those locations preferred, it's also going to limit some of the things that they can do with those non-preferred locations. So you have the ability to place limitations for both the EHR and PM applications. So we can limit for non-preferred locations for drop-down lists and also reporting. So, in combination of selecting those preferred locations and using these checkboxes, we can really help to limit the visibility of items at those non-preferred locations. So, for example, you could use this to limit when a user is choosing their location for EHR documentation, or even if they're running financial reports in PM. So in addition to restricting the ability to select those non-preferred locations, as we saw in the Locations tab, we can also modify several security rights for those non-preferred locations. So we would do that on this Location Restriction tab. And then based on those preferred locations that were set up on that previous tab, we have the ability to limit rights for things like charge entry, transactions, and our encounters. So again, in combination, that's just going to even further limit the access that users have, for those locations where they don't really have any job functions. So on the EHR side, when we use those preferred locations and lock down that access on that Location Restrictions tab, you can see in this graphic how it's going to affect a user's view of the chart. So for any of those non-preferred locations, a user is not going to be able to create new clinical encounters. They also will not be able to modify existing encounter properties. The user would also not be able to see those non-preferred locations in a drop-down list. So again, like that, location list that they select before documenting in the EHR. And then finally, a user would not be able to run any EHR reports that include data associated with those non-preferred locations. It is important to keep in mind, however, that these non-preferred locations are still visible to the user in the history toolbar. So they're going to see those existing encounters in that toolbar. They would also be able to expand those encounters, and they can view any templates that were opened or documents generated. And then finally, if the encounter is unlocked, a user will be able to edit any of those existing templates, regardless of if it's at a preferred versus a non-preferred location. So on the PM side of things, we're going to kind of see a similar effect to the PM chart, some of that financial data. So for any of those non-preferred locations, a user is not going to be able to create a new billable encounter. They also are not going to be able to modify the properties of any of those existing encounters. They're going to be unable to add any new charges or transactions for those non-preferred locations. We would see the drop-down lists for the PM side are also going to be limited to just the user's preferred locations. And then any PM reports that are run are not going to return data for those non-preferred locations. So that can really help to minimize that visibility, let's say appointments or financial data for patients that are outside of the location that the user works. But just like we saw on the EHR side, these restrictions are not going to limit the visibility of the patient data, as far as just being able to view it. So a user is still going to be able to see those existing encounters on the Encounters tab of the chart. They can actually view any charges or transactions that were entered for those encounters, even if they're associated with non-preferred locations. So as you can see, while setting up those preferred locations and adding some of those additional restrictions, it can limit some of the ability to add or edit, but it still does leave a little more visibility for the users outside of those preferred locations. So there are some additional options that you can use to even further restrict. So not only just the ability to add, but also to view that patient data. So one of these options is what's called a template restriction. So our templates can be restricted at two levels. So it just kind of depends on your practice and what you need. So the first option is at the practice level. So if your system is broken down into separate practices, so you have multiple practices in your enterprise, you can use what are called template sets. Basically, our template sets are going to group our templates together, and then you can actually restrict that access to different templates for each practice. So you can say, this particular practice only needs access to this group of templates. So within one practice, we also have the option to restrict our templates at the group level. So we would actually remove the rights to that template for individual groups. So it just kind of depends on what you're looking for with your practice. So let's take a look at how we configure both of these options. So our template sets, these are, like I said, groupings of those similar templates. And they can be assigned then to individual practices that need access to those templates. So these sets are assigned in System Administrator. So we select our practice on the left-hand side, and then you'll see our template sets section. So if no templates are selected in this window, then users in a practice are going to have access to all templates in the system. So essentially leaving this blank is not going to restrict any access. However, if you select one or more template set, then users are going to be limited to being able to use only the templates found in those selected sets. So our template sets, they can kind of be created in two places. So you can create them in Template Editor, or also when using our template import export module. So in Template Editor, when we're creating a new template, let's say, or we can even go back and open up an existing template, if you want to create these sets or modify them, we go to our Tools menu and then open up our Template Sets window. So from this window, you can actually create new template sets. You can modify existing ones and change which templates are in which sets. So when our template sets are used to restrict access at the practice level, so any users within that practice are going to be unable to view that restricted template in our templates module. So therefore, if you can't see it in the templates module, you won't be able to select it. So you're not able to use that template to add it to encounters for documentation. The template sets do not, however, prevent a user from viewing that restricted template. So if it's been previously added to an encounter in the history toolbar, they would still be able to see that. So if your practice would like to have a little more control over how you restrict these templates, so instead of at the practice level, let's say you want to remove those rights for particular groups, you can use our security groups to do that. So we can find rights for our various templates under our module section of our security rights. And our templates are broken down into several categories. So you can kind of determine, do I want to limit some demographic templates, medical records, things like that. So under this right, we can take away individual rights for the templates. So the ability to view the template, add it to an encounter, or even make updates to those templates. So if you do choose to remove all those security rights for a particular template in System Admin, the user is going to be unable to view that restricted template in the templates module. So therefore, they're not going to be able to add it to an encounter. And they would also not have the ability to update any existing templates. So with these restrictions in place, the users in the group will, I'd say, kind of have the ability to view the template when it was previously added to an encounter. I say kind of because it's going to be there, but it's going to display as restricted in the history toolbar. So essentially, they're not going to be able to tell what type of template it was or see anything that was documented. They can just see that a template they don't have access to was added to that encounter. So here's an example of what that would look like. So you can see here I have a template. So as a user, I can see there was a template there, but it says restricted. I can't see, what the template was, any of the information documented, anything like that. So essentially, it's hidden from my view. I can't tell what's there. So, as we've kind of looked at so far, you can restrict access to those non-preferred locations, and we can, just restrict the ability to view templates. So another layer that can kind of be added, in combination with those options would be the ability to restrict access to particular documents as well. So our documents are going to be restricted in a similar way that we just saw our templates were. So again, in System Administrator, we can go into our rights and we can choose individual documents from that modules group of rights to restrict access. So here again, we can have the ability to restrict the ability to view those documents, add them, make updates, or even print those documents. And again, this is going to be in our security rights, so this is at the group level. So if a particular document that you'd like to restrict is not listed in this list, you can actually add to this list. So, if there's some custom document or something that you would like to add and make restrictions on, we can do that under our security right for that EHR documents assigned. So you would highlight that right, as we can see on the screen, and then you would click that Add Documents button. So that's going to allow you to choose from any documents in your system. So we can look by folder, or we can even type in and search for the name of a particular document to add to our list, and then therefore restrict those rights. So if we've restricted all rights for a particular document, a user is not going to be able to generate that restricted document. So that includes, whether from the documents module or even from a template, they will be unable to do that. Users in that security group are also not going to be able to view the content of a previously generated document. So essentially that's going to conceal, any of that patient data it might include. You can also restrict documents so they can't be printed by the user or even sent to the patient portal, depending on that security group. I did want to make sure to note that users are able to still view those restricted documents in the documents module. So unlike our templates, they're not going to be completely gone. But if they did try to generate or print that document and they don't have the rights, they will get an error message. So essentially, they don't have the access, but they'll still see it in the module. And then, like we saw with our restricted templates, restricted EHR documents are going to show as restricted in our history toolbar. So, again, they can see that something's there, but they can't see the name of the document or any of the data that was generated on it. So here we can see on the left-hand side, that's an example of a restricted document. So again, I can see under my encounter that something was generated, but I can't see the name of the document. I can't open the document. So, it's essentially hidden for me. On the top right, we can see the error message that a user would receive. So if I did try to open that restricted document, you'll see it's just going to say unable to display, and it will let them know that permission's denied. So essentially, I can't see any of the actual data in the document. In the bottom right, I can see the error message if I tried to print a document. So again, I would get that error message. It's not going to let me print out that document, so therefore I can't see any of the data generated. So you can see that, by removing these security rights for a particular document, essentially it's going to hide that data from any users who don't really need to see it for their roles. So for example, let's say a practice who has behavioral health locations, you could use this feature in combination with restricting those templates, and that's going to hide not the entire visit from a user, but it would hide what the patient came in for, and especially the data of what was actually discussed during that visit. So up until this point, all the options that we have discussed, they dealt with, really restricting users' ability to, navigate in places in NextGen, or potentially, concealing data that's, was previously documented. So our next feature is a little different. Our sensitive encounters help to increase your practice's security in a little different way. So our sensitive encounters in NextGen, instead of restricting access, this is actually used to allow your practice to control what information is being exported out of the system. It's going to give your users some indications, letting you know that an encounter contains sensitive information. And so, the hope is they're just going to pause and kind of think, should I print this? Should I send this? Things like that. So we can use this feature to limit things like reporting. We can use it to control what encounters are included on statements, what information is sent to the patient portal, and then also, to control that data that's exported directly from the system. For example, like our CCDAS. So it is important. I just want to make sure it's clear that these sensitive encounters, they're not really intended to restrict a user's ability to view that information within a system. So, unless you are using some of those other restrictions that we mentioned, a user can still view that information. This is really just to, hopefully make them stop and think, should I be, doing something with this data? So by default, the ability to use sensitive encounters is enabled in our security rights and system administrator for our groups. So if you did want to limit the ability to mark encounters as sensitive and set up some of our features, you can turn off that right. We'll find that in our system admin on our rights tab under operations. And then we'll expand encounters, and then our right is set and unset encounter to sensitive. So I do want to point out that besides that little piece of, maybe modifying those rights, that if your practice does, use a health information exchange, for exchanging data, that both Rosetta and the HIE gateway should be configured separately to utilize these sensitive encounter flags. That doesn't happen by default, such as the additional piece of setup you would need to do. So when our encounters are marked as sensitive, that's done in the EHR application. So if your practice has upgraded, plans to upgrade to 5.9.2020.1, you will find that in that version and going forward, sensitive encounters will now have an indicator in the practice management application as well. So they're still marked as sensitive in the EHR, but you can view them in PM as well. So if I wanted to mark an encounter as sensitive, I would locate that encounter in the history toolbar. And then as long as I have the proper rights that we just discussed, when I right-click on the encounter, I would select sensitivity settings. So in the sensitivity settings window, you'll see that I have a few options that I can configure. And this is for each individual encounter, just depending on what I need. So if my first checkbox there is going to actually mark that encounter as sensitive. Additionally, you can choose to do things like suppress the auto send of data from that encounter to the patient portal. You can also choose to suppress our outreach actions. So if you have a practice, using NextGen Care Outreach, you can suppress those automated communications that go out. And then finally, you also have the option to not print this encounter on statements. So now let's take a look at how marking that encounter as sensitive and using some of the additional options, how it's going to look to the user. So first, if a user attempts to print data from an encounter that's marked as sensitive using that custom print and send feature, they are going to receive this prompt that we see on the screen. So this is just informing the user that the data they're attempting to print has been marked as sensitive. So, it's important to note that it's not going to prevent a user, if they choose to ultimately say proceed and go ahead and print, they still will be able to. The hope is that they're going to, cause users to kind of pause and think. It says on here to look at your practice's policies before actually printing that data. I do want to point out with this custom print and send, it's for printing, but it applies for faxing as well. So when a user is marking that encounter as sensitive, they also have the option to suppress auto sending to the patient portal. So that's just going to allow your practice a little bit more control. So if you are sending things to the patient portal, you can, instead of just automatically going, you can stop and have the user review that sensitive data before it's sent. So if there is information from a sensitive encounter that is going to be sent through the portal, the user can choose to manually send the data if they choose. So like we saw with printing, the user are going to get this prompt. Again, this is not going to stop them from sending that information if they choose to, but that at least they'll be pause and kind of review the information before it's sent to the portal. So another area that users might be prompted before sending in that sensitive data would be in our medical summary utility. So when we're exporting that patient data, like for example, creating a CCDA, any of those encounters marked as sensitive are going to display with a red exclamation point in the utility. So that's going to help users quickly identify those sensitive encounters while they're generating these documents. So in addition to that indicator, if the user is using any of those clinical information filters, they're filtering to find specific data to send in that utility, information from sensitive encounters is not going to be included. So the goal is just to prevent that from unintentionally being sent So they can choose to manually include it, but it won't be automatically included. So if a user does want to include that sensitive data in a document that's going to be exported, they can choose to manually include that data. So they're going to be prompted to say that there is sensitive information included. And again, they can choose to say okay to continue forward. So it's not going to stop them from including that data, but again, just pausing, review the information that they're sending before they actually export that document. So now that we reviewed several of those options for limiting user access, we saw it's kind of more to like pieces and parts of the patient data. I wanted to review a few options that will help us restrict a user's access to that patient altogether. So there may be times when just restricting certain templates and documents may not be enough. So for example, you may need to limit access to the chart, of maybe your employees who are also patients at your practice. Or even if your practice has high profile patients, you want to keep that exposure limited. Because let's be honest, even your most honest employees are going to have really hard time not peeking at the chart of, I don't know, let's say Beyonce, if she ended up at your office. So let's make it easier on them, and we can limit the visibility of those patients. One of the ways we can do that is through inclusion and exclusion lists. So our inclusion and exclusion lists can be used by your practice, like I said, to lock down the ability to either view particular patients or even limit altogether. A user can only see specific patients, so just depending on their role. So our first option are inclusion lists. That's going to allow you to select individual patients, and then the user would only be able to see those patients that you select on that list. The other option is our exclusion list. So let's go back to my Beyonce example. You would select specific patients, and then the users would only have access to all other patients except those on the list. So both our inclusion and exclusion lists are created in System Administrator for each user. We do also have the ability to share those inclusion lists among other users once we have created it. Any modifications that we need to make to these lists, after they've been created, it can be done here within System Admin, but you also have the ability to make changes within the EHR if the user does have the appropriate rights to do so. So our inclusion and exclusion lists are created by checking off the appropriate list, in System Admin. And then when you click that modify window, you're going to see the list here. So if there are any existing patients, either included or excluded for the user, you'll see those here. And we can also use this screen to search to add to either list. So you can see here, you can search by things like last name, first name, a person number, things like that. So once an inclusion or an exclusion list has been created in System Admin, as I mentioned, it can be modified directly within the EHR as well. So we can find that modify inclusion exclusion list window under our admin menu in the EHR. And this is going to be that same window that we saw in System Admin. So, it doesn't matter which place you make those changes, they'll have the same functionality. I did want to point out that the user does have to have those appropriate security rights to make those changes, as I mentioned in the EHR. So you don't have to worry about just anyone making those changes. So another setting that I wanted to point out in regards to our inclusion list specifically is a universal preference, and it's called Add to Inclusion List from Patient Lookup. So if your practice does have this universal preference set to yes, it's actually going to give users the ability to see those records that aren't included in their inclusion list. So when they search, those records are going to display in gray, so they can see the difference between ones they have access to versus not. But then if they actually try to open up that grayed out record, they'll be prompted with this prompt that we see on the screen to add that patient to their inclusion list. So, obviously, if your patient, or if your practice really wants to lock down those inclusion lists, make sure it's only the people with the appropriate rights can make modifications. I would just recommend, double checking that universal preference is set to no. So another option that we can look at besides our inclusion and exclusion lists to restrict that user ability to access records is our privacy levels. So our privacy levels are going to function kind of similar to what we saw on our inclusion and exclusion list, in that they limit that ability to view the entire record for specific patients. But our privacy levels are going to allow a little more granular control. So it's also going to be a little less manual setup than what we saw with our inclusion and exclusion lists. So users in the system are assigned a privacy level access, and it's going to be from a range that's specified by your practice, just depending on how you want to set up those patients. So let's say, for example, your practice uses a 0 to 5 range. So in that example, the 0 is going to be the most limited access, and 5 is going to have the broadest access to patient records. So, let's say a user is given a privacy level access of 3, then they are only going to be able to see patient records with the privacy level of 3 or lower. So, any patients that are given a 4 or 5, they would not be able to view those patient records. So then, after those users are assigned privacy level access, patients are then assigned a privacy level, again, within whatever that specified range is set up by your practice. And those are assigned on our patient demographics template. So I did want to point out that with this setup, not every patient is required to have a privacy level assigned. So if a particular patient doesn't have a privacy level, then the users would be able to view that patient regardless of their access. So the first step in setting up these privacy levels for your practice would be to assign those access levels for your users. And as I mentioned, that is done in System Administrator. So again, you can select whatever that range is depending on how many different levels you will need. And again, that 0 would be the most restricted access up until, if you're going 0 to 5, 5 would be the least restricted. So the next step would be to assign those privacy levels to the particular patients. So as I mentioned, this is done in the EHR on that patient demographic template. So out of the box, the field that we use to assign those privacy levels is not enabled on this template. So if your practice does plan on using privacy levels, you can actually open up that template in Template Editor, and then you can unhide that privacy level field. So then you can start using it on your template. So as you can see, using those different privacy levels, you really have a lot more customization. You can choose as many different levels as you'd like and really customize, what users can access, to which patients. So another key component to your practice's internal security is the ability to report on what information is accessed in your system and by whom. So, as we know, even with the most locked down system, things can still happen. So it's still important that you're aware of what's happening with your data. So whether it's, there's been suspicious activity, or maybe you're just doing a routine audit or just, putting feelers out for your security system. Reporting on your security, it's important, that you know how that data is being handled and make sure it's done appropriately. So one of the main methods that you can use to report on the security of data in your system is advanced auditing. So our advanced audit is a tool that can be used to audit specific user activities throughout NextGen. So if you have been using NextGen for a while, you may be used to hearing the term significant events, when we're talking about, tracking user activity. So I did want to mention that significant events were used, they were kind of like the precursor to advanced audit, in versions prior to 5.8. So they still are available in later versions. You can still use them to this day. They just do not meet meaningful use requirements anymore. So for meaningful use, you want to make sure that you're using your advanced audit tool. But if your practice still, continues to use significant events, just kind of, internally for your own information purposes, there's no harm to doing that. So data captured from advanced audit is accessed through what is called the Audit Report Tool. And the data that can be recorded by using this advanced audit can be pretty substantial, depending on the number of users in your practice and the size and everything like that. This information is normally stored in a separate database and typically on a different server. So not a requirement, just again, depending on the size of your practice. So we actually configure our advanced audit for your system in System Administrator. So we would go to the View menu, and then we would select Advanced Audit Setup. So on that General Setup tab, you can enable the advanced auditing feature so that you would turn it on in the first place. And then you can also configure your servers from there. Here on our Advanced Setup tab, this is where you would select what individual events you would like to record the data for. So, for example, you can record whenever a user logs onto an application, if an appointment's accessed, if medication is modified. So that's just a few examples. You can see there's a ton of options. So once advanced audit events are configured for your systems, you can actually view the data collected using the Audit Report Tool. So in this tool, we have the ability to filter our data. So we can filter by enterprise, by practice, individual user in the system, person if we're looking, for a particular patient, any actions, and then even date range. So, obviously, depending on your system, you might be collecting a ton of data. So this will kind of help you narrow down to what specifically you're looking for. You would also have the ability using this tool to generate a report. So that report can be viewed in the tool, and then you have the option to print it or also export that to Excel. So as we mentioned, it's important to make sure that your system is set up in a way, that kind of helps users, whether inadvertently or we hope not maliciously, use that data inappropriately. So, just as important it is to lock that down, to be able to actually view the activity in your system, it's just really crucial to making sure that, you don't have any activity going on that you're not aware of. Okay, so as you can see, there's a lot of different options that can help you lock down your system from the inside. And again, the whole goal of this is just to ensure the right information is being accessed by the right users. So now with that being said, I'm going to turn it back over to Lindsay, and as promised, she's going to review the other side of security, so what's happening outside of your practice.
Awesome. Well, thank you, Lexi. A lot of really great NextGen knowledge there that I know, users can take back to their practices. Since we are short on time, just a little bit here, truly our priority today was to make sure you all walked away with some new information and actions you could take and actually apply to your NextGen environment. So we actually won't, go too deep into the current industry facts or really kind of go over those threats at all really today. Which brings us an interesting enough full circle back to our, inside out thought process here, prioritizing your internal system. I promise we didn't plan this though, but, all jokes aside, we already know this is a very unique time in healthcare right now. There's been a huge increase in external threats and ransomware targeting the industry. So you can flip to the next slide just to show some of the headlines out there so you get an idea. I joke that this slide took me about 5 minutes to create, and about 4 of those minutes were spent just formatting it so they all fit. These headlines are a dime a dozen right now. You can just Google cybersecurity and they're popping up everywhere. So we will be sending out a copy of these slides, and feel free to look at these in detail, as well as our previous webinar that we actually had a few weeks ago called Protecting Your Practice Against Hackers During the COVID Crisis, and it's actually available, the slides and the recording, on our website. I also included a resources slide here, which Lexi, you can kind of flip. I think it might be 2 more. one more and maybe another one, the next one, yep. Perfect. So, I don't claim to be an expert on cybersecurity by any means, but, I do claim to be an expert on finding the information and resources for you guys. So I listed some of the resources that are brand new. They're listed on the HHS website. They are also listed on the Cybersecurity and Infrastructure Security Agency website as well. So you have these kind of as a condensed list for you that were just released, and you'll have access to these when we send out a copy of the slides. Perfect, so we can go ahead and advance to the next steps. It brings us really to the end here to wrap things up. We are going to go ahead and open it up for questions. I know we've had a lot coming in of some really good questions here, which is why I wanted to leave time so you guys could get those answered. But we hope we provided some timely and helpful content here. We really are here to help in any way we can. And, before we do get to questions, as always, if you're uncertain where your practice may stand, iTenv can help you. We can assess your current practice state, provide recommendations, and really help implement, new processes or procedures, not only related to this topic, but, really anything related to NextGen or practice operations. Of course, feel free to visit our website, continue to sign up for our webinars, visit our blog as well. And then, of course, consider some of the services we do offer. We have those on-site consultations for EHR, PM, and technology. They're 3-day fixed price consultations to review current operations and provide you some really personalized recommendations on how to optimize your system. And as Chelsea mentioned, test drive our products. We have a demo coming up for a solution called ChartGuard next week. It's actually a business continuity solution, which is pretty timely right now and based on this topic as well. So you can always, of course, reach out to us directly. We do have our contact information listed coming up here on the next slide, but we will go ahead and open up the floor to questions now. So thank you everyone for joining us today. I'm going to turn it over to Chelsea to kind of navigate these questions and dish them out for us. So hopefully we can go ahead and answer those for you.
Okay, awesome. Thank you, Lindsay. And thanks, Lexi, for all of the information. And everybody, thank you for joining us. If you have questions, again, you can put them in the questions area of the webinar control panel. We do have quite a few. We're going to go through them all, though, so feel free to hang on and sit tight with us. If you have to leave early, I will be sending out a copy of the presentation slides and the recording within the next week here, so you can always catch up what you missed at that point as well. So we're just going to go through them in the order that we received them. First question, how can you limit deactivated employees from lists on reports for everyone?
Yeah, Chelsea, I can take this one.
Yeah, please.
So I think if I'm understanding, if employees are deactivated, I think if you're asking if the ability to report, when they're moved to that deactivated, then they would no longer be able to log into the system. So they would not be able to, do any reporting. So really that, process of deactivating them should, take away their rights and kind of prevent them from accessing any system, if I'm understanding your question correctly.
And if that wasn't the question you were asking, feel free to type it back, your reply, and we will circle back to that one. Next question. If an employee is a member of multiple security groups with different EHR and PM location restrictions, will they allow or deny permissions override restrictions? In other words, if they are allowed to view a location in one group, but not allowed to view the same location in another group, will the user be allowed to view the location or not?
Okay, Chelsea, I can take that one as well. So it's a great question. So actually our preferred locations and our location restrictions, that's at the user level. So that's not linked back to a particular group. So a user you would set up preferred locations for that user, and regardless of those security groups, they would only be restricted to that particular location. If you're referring to on the location tab how there's some additional rights you can restrict, that's going to override anything regardless of group. So it's at particular individual user setup, not at the group level.
Okay, thank you, Lexi. Next question. With sensitive encounters any setting to set all encounters from a specific location and/or event type to set for sensitive? For example, everything behavioral health or everything on a minor that has reproductive related?
So that is a great question and a feature that I'm sure plenty of people would like to see. Currently, there's not that built-in ability. I mean, I know some people are, wizards with SQL, so potentially you could, modify those sensitive encounters, markers in that way. But out of the box, there's not currently a way to do it, in kind of any bulk or mass way. But yeah, that's a great feature that, maybe we'd see in the future.
Okay, next one. Inclusion exclusion. It's very resource intensive to maintain. Is there a way to do this by security group or copy one user to another?
So yes, I know that is one of the things about inclusion and exclusion lists. Obviously manually setting those up per user can be, like you said, very intensive. So there is the ability to share those lists just for the inclusion lists. So you could set those up in System Administrator and then select share and share those among users. But unfortunately at this time, there's not that same ability for exclusion lists.
Okay, and here we have an inclusion exclusion user tip. Somebody said, we found inclusion very helpful with audits to make sure auditors can only see the specific patients they are auditing.
Yeah, that's a great point. That's, I would say, one of the main ways that I've seen inclusion lists used. Yeah, you can just choose specific patients and then, really lock down what they're able to see. So yeah, great tip.
Thank you. Yeah, thank you so much for sharing that one. Security level. Can someone break the glass type functionality if they need to access something usually above their security level? Maybe a high profile patient has a high security level, but the MA still needs to room the patient, then the front desk still needs to see him to check him in?
So I'm not really aware of any kind of, if I'm understanding like your break the glass, like emergency access type of functionality, but that's definitely something I can research and get back to you. But yeah, not that I'm aware of.
Okay, next question. Hello, what prevents one of our end users from changing the privacy level of a patient's chart to a privacy level that an end user can access?
Yes, so that is a great point. There truly isn't, if they have access to that patient demographic template, yeah, I guess they theoretically could go in and change that. So, either that would be something that maybe create a separate template that only certain users have access to, or a separate version of that patient demographic. Or that's another place that, maybe you could use your advanced audit to track and see if, users are making changes to that. But yeah, that is a good point to kind of lock that down.
Okay, next question. In running group reports via file maintenance, is there a way to compare two groups? I go into the test database and temporarily rename the groups so that they will be listed next to each other and use two filters and use group names between group A and group AA group.
Yeah, so I think I'm understanding the question.
Sorry, I misread that one. Do you understand the question? Sorry.
Yes, I think I do. Yeah,
okay.
No, that's no problem. Yeah, so I would say, so actually I did for one of our clients, they asked if I could, compare security groups and kind of, review rights. And the way that I found the easiest, just because for me, generating that reports can be really long if you have a lot of groups. I actually exported the report to Excel, and then I put the different groups, side by side in different columns, and then did, Excel has different like compare tools that you can use. So that's how I found it easiest to kind of compare those, just by exporting to Excel. So that potentially could be a way that you can do that.
Okay, and it looks like this might be our last question, which is a follow-up clarification to our first question, but we'll hang on in case a few more people are still typing questions as well. So to clarify that first question, I guess what I'm asking is, the deactivated employees still show up as creators in report settings. So is there a way that I can take them out of the list so that not everybody sees them? Like in the mailbox, I still have employees that have been gone for 10 years, but they are deactivated in the system admin.
Okay, yeah, I think I'm understanding your question. Yeah, so as far as those deactivated employees still showing up, I mean, yes, if there's things like, yeah, they created a report, I mean, that's still going to be the case. So I would say that, yeah, as far as fully removing them, not really, because, you know, it kind of keeps the integrity of that record. You know, they did create that report at one time. So yeah, as far as I'm aware, there's not really a way to completely remove them from the system. I would say, you know, in the case of that example of a created report, you know, potentially recreate the report. So that's under, you know, your own name or a different user's name. But yeah, not really as I'm aware as far to completely remove them from the system. Kind of, you know, keeps that record of the fact that they were, you know, there at one time.
And I would say if that wasn't the question that you were trying to get answered, you see Lexi's information up on the screen, ldemarche@itenif.com. Feel free to shoot Lexi an email, and I'm sure that she'd be happy to communicate one-on-one with you to help get clarification and a more thorough answer, if that wasn't it. Well, it looks like that's all the questions that we have. So thank you everybody for joining us today. Thank you, Lexi and Lindsay, for throwing this presentation together. Again, you see Lexi and Lindsay's information up on the screen. Feel free to reach out to them if you have questions after this. You can always reply back to my email that I'll be sending with a link to the slides and the recording. Basically, any way that you can get a hold of us, we're happy to help. So don't hesitate to reach out to us. And thank you everybody for joining us, and have a great day.
Awesome. Well, yeah, thank you, everyone. Have a good day.
Okay, thank you.